Before I came to UNC Health, my health journey was long and challenging. I was diagnosed with Crohn's disease when I was in high school, which is an autoimmune illness, and I had a challenging time of it for a few years. When I graduated college, I actually, that summer, had a really big flare and ended up in the hospital for a couple of weeks. At that point, I knew something had to change. I knew that the care that I was receiving was not helping me in the way that it needed to. So that led me to a friend who was getting her care for Crohn's disease at Chapel Hill. And I said, please get me in touch with whoever you see if you like them, because I just need to see someone different. And that's really when everything changed. We decided to go with maternal-fetal medicine at UNC when I became pregnant with my son. Before I became pregnant, I had long discussions with my provider about medications and just things that might need to be tweaked that would help me in my fertility journey. And that was the type of care that I had never received before. With all of that being said, I decided that all of my care that I had received that was so wonderful and that I trusted was at UNC, and I felt like that was where I needed to be in terms of delivering my son. Everything was evidence-based, everything was explained to me in a way that I understood, and they worked with me as a patient. If something wasn't working, we worked it out together. I mean, I would make that drive again and again. So it's about a 2.5-hour drive for me, and when I was making it a couple of times a year, it wasn't necessarily as big of a deal. And now it still is a lot of gas money, a whole day off of work. My husband often goes with me, so he takes the day off work too. Now we have to arrange childcare. It is a lot that goes into it. To get this type of care closer to home would mean a lot to me and my family. If I just could go down the street to get that would just be the icing on top of the cake. I think that a lot of people unfortunately don't have the ability to travel when it comes to their health care, and they would go to Chapel Hill if they had the ability to. And so to have a hospital in town that is providing that state-of-the-art care would just be so meaningful to Wilmington. I have a healthy 1-year-old now, and I'm in remission from my Crohn's disease, which is all thanks to the continued care that I've gotten at Chapel Hill. If I could say one thing to my neighbors about what's coming to Wilmington, it would be to get excited about the care that UNC has to provide. And I no longer have to worry about the unknowns in my healthcare journey. I can place my faith in the professionals at UNC and know that I'm always in the best of hands.